It's essential to become mobile as soon as possible after surgery to help your circulation. Whilst in hospital and with the approval and assistance of health professionals, sit up in bed to eat meals, use the bathroom and walk the length of the corridor. Women with reconstructions using abdomen tissue may find it difficult to stand upright. It's okay to walk bent over. Let standing upright come naturally. You'll also be shown how to move while protecting your wounds. The following exercises will promote the circulation of your blood and lymphatic fluid after your surgery. This will help you to heal as quickly as possible and minimise any risk of lymphoedema. Because your movements will be restricted, especially in the first weeks after surgery, you must do these exercises 4 times a day, every day, to keep your circulation moving. Linking your pain medication with these exercises is a good way to set up a routine. Doing small amounts often is better than one big session of exercise. Remember, none of your exercises should affect or pull on your drains or stitches. Using a mirror is a useful way to know you're doing them correctly. To start, sit upright in a chair. Imagine your head is a balloon. Let it float up away from your body. Take 5 slow, deep breaths in through the nose and out through the mouth. This stimulates circulation in the trunk, relaxes you and allows your mind to focus. Then, point your toes in an up and down motion to pump your calves. Repeat 5 times. This exercise decreases your risk of developing a clot. Increasing circulation in your neck is important too. In the following exercises, be careful not to move your neck too far to avoid pain or dizziness. To tilt the neck, keep your shoulders still and bring your left ear to your left shoulder until you feel a stretch on the right side of your neck. Hold this position for 3 seconds, then slowly bring your right ear to your right shoulder to feel a stretch on the left side of your neck. Repeat this movement 5 times. To turn the neck, keep your shoulders still and turn your head to look over the left shoulder until you feel the stretch of your muscles on the right side. Hold this position for 3 seconds and then slowly turn to the opposite side and hold for 3 seconds. Repeat this 5 times. Now, keep your shoulders still and look down to the floor until you feel a stretch in your neck muscles on the back of your neck. Hold this position for 3 seconds and then slowly look up to the ceiling until you feel a stretch in your muscles on the front of the neck. Do this 5 times. It's also important to increase the circulation in your arms. There are several exercises for this. Shrugs. Lift your shoulders up to your ears as you breathe in and then let them drop down as you breathe out. Repeat 5 times. Next is a modified breaststroke. Keep your hands level with your shoulders and do a breaststroke movement. Make sure you move your shoulder blades as well as your arms. Only move as far so that there's no pulling on your drains or stitches. Repeat 5 times. The next exercise requires you to have your elbows straight and hands open. Make a fist. Bend your wrists and elbows to touch your shoulder. Then reverse the movement. Do this 5 times. Now, do your deep breathing and calf pumping exercises again. It's important to be in tune with your arms and drains. Monitor the output of fluid from your drains according to the advice of your breast care nurse or surgeon. Massaging both arms with moisturiser in a motion towards your shoulder is a good way to keep your skin healthy and to notice changes in your skin or any differences in the circulation between your arms. You should contact your breast care nurse or surgeon if your arm feels tight, heavy, or has a dull ache. If you notice the skin on your breast, arm, or hand has heat or redness, or if you begin to feel unwell, seek medical advice as soon as possible. You can find further information through Breast Cancer Network Australia and the Australian Cancer Council.